If you're an avid MMA fan like myself, you woke up this morning to the news of Jamahal Hill relinquishing the cursed 205-pound belt because he suffered a terrible injury, the rupture of one of his Achilles tendons. So in this video, we're going to explore the simple anatomy of the Achilles tendon. What does it work for? How does it get injured? And how we diagnose and fix it. Of course, if we're going to talk about the anatomy of the Achilles tendon, it connects the calf muscle to the talar area of the foot. It allows you to push off and create explosive movements with your lower extremities. It's simple. When you're defending takedowns, you're putting pressure, you're pushing off the Achilles tendon. When you're pivoting to do kicks, the Achilles tendon receives a lot of pressure, and especially in training, MMA athletes have crazy training. And on top of that, you have the heavier fighters. Of course, Jamahal Hill, a little bit on that upper scale of 205 pounds. So it's a big guy that's heavy, that's very muscular, very strong, very explosive, as we saw in his Glover Teixeira fight. What types of Achilles ruptures are there? We're going to simplify it. Two types: complete and partial tears of the Achilles tendon. What happens is you're pushing off, or you're changing direction fast, like when an NBA player is crossing over. We see a lot of Achilles tears in the NBA for that very same reason: change of direction against the strength of the Achilles tendon, and then it snaps, creating a gap between the calf and the talar area of the foot, the posterior area of the foot. In Jamahal's case, from what I've heard, it's a complete tear. Therefore, it needs to be repaired, and he relinquished the 205-pound belt. What do we do when we have a fighter that thinks that he snapped his Achilles tendon? First of all, it's a very audible injury. It's described as the snap of an elastic. A lot of athletes that suffer from this, they actually hear the big tendon snapping. There's a couple of examples of Achilles tears that have occurred and have been visible in video and social media here playing on top of my voice. How do we diagnose it? Of course, the presentation, the pain in the area, and there's the Thompson test where we squeeze the calf. And if the toes don't point downward as a reflex, you might have an Achilles rupture. With everything in high-level sports, of course, we have to do a magnetic resonance image to get the details of what this injury of what the extent of the injury is. The gold standard here to repair a complete tear of the Achilles tendon, of course, is surgery. So it looks like Jamahal Hill might be out for a whole year. That's why he relinquished his belt, because it's too long of a rehab process. This is a bummer for Jamahal. I've seen pictures of him, getting on the heavy set side. That might have played a role. He might have had a partial tear during one of his last fights, which were very intense and very, against fighters that were really strong. Pushing off those bodies in that way could definitely lead to some microfractures of the Achilles tendon, and leading up to having a complete rupture of the Achilles tendon. So let's hope for a quick recovery. Of course, he's going to have surgery. They're going to stitch that bad boy back together. Of course, with the advent of stem cell therapy, a lot of UFC fighters are undergoing that. So I wouldn't be surprised to see Jamahal Hill cross south of the border, get some stem cell treatments. And, he's hungry to get his belt back. It's a revolving door in the 205-pound boy. So we'll see what happens with this injury. Let's hope for the best for Jamahal Sweet Pea Hill. Man, what a story. What a story. See you on the next video.